And so I'd like to introduce our speakers. First, we have two speakers who are going to be talking about health and specifically planetary health. And after that, we will have two speakers looking at it in the more broad context of sustainability and resilience. I mentioned before, we'll have inputs from our panelists, a round of panel discussion in plenary, and then depending on the dynamics of time allows, we'll also do some breakout groups for smaller discussions before closing in the plenary. So without further ado, I'd like to introduce our first speaker. Dr. Nicole De Paula has a PhD in international relations, and she's the founder and director of Women Leaders for Planetary Health. She was also the first Klaus Tupfer Fellow at ISS. For more than a decade, she's been connecting policymakers and researchers at global scale to create a public understanding on key issues related to sustainability, environment, and public health. And she is going to speak to us today about planetary health and breaking down so-called silos. So with that, I'd like to turn it to you, Nicole.
Great, thank you, Katie. Thank you for the invitation to be here with you all. It's a pleasure, even if it's a light lockdown. I think COVID, of course, continues in our minds. So let me share my screen here. And I do have some slides to share with you all here. Just please confirm if it's that okay. And then I'll see you all here. All right, so I'll leave here some, at least you, Katie, and Martin, so I'm not alone. So let's get started. And I want to start on this more positive note, because even though we're talking about COVID, and it's of course a very difficult moment, today is still the best day to be alive. We have many reasons to celebrate. If you look at this metrics of the human population is really healthier than ever before. So it's important to highlight the, of course, poverty, child mortality, or life expectancy in general. They have improved around the world. Of course, these improvements, they have been very uneven, but still there's a lot to celebrate in terms of how human development in general has been happening. But today is also the worst day to be alive, and it's not only because of COVID. And I think we're going to show today how these two crises are connected. Of course, this massive footprint we are having on our planet is the whole point we want to bring today is how is it impacting human health? And of course, this other horrible photo here, making our oceans, the trash of the planet, is creating a large problems that goes way beyond from just our fisheries. So if you see, it's what is interesting about the field of planetary health that we're going to discuss, it is, of course, that to achieve this progress in so many metrics of public health, we have used and exploited the planet in a way that was really unprecedented. So these are some examples. The water we have been using, the majority, I think it's 60% of our land on Earth now being used for agriculture. With the massive increase of population and the exploitation of natural resources, we are now seeing the risks to jeopardize this massive improvements that we had. So this kind of paradox of what we are seeing, what the progress on one hand, and this new risks emerging. And that's why we say here, let me just reduce in the end, Katie, put you here on the side. So we said human health in the Anthropocene really deserves rethinking. Planetary health is just a refined way to talk about public health, to understand how exactly could we really talk about healthy people in a sick planet? That's a key question that we're trying to address here. So it has strong roots in ecology, in systems thinking, and the history even of the environmental movement. This concept gained a lot of force in 2015 because there was the launch of this Rockefeller and Foundation and Lancet Commission on Planetary Health that was really pushing for, and this is the photo saying, not a question, but saying it is time for a new discipline, especially coming from the side of the public health sector. So the definition that there was in this report that kind of brought this field to a more to our attention is the health of, so planetary health is really the health of human civilization and the state of natural systems on which it depends. Sounds a little bit obvious now if you think that, but if you, and Martin, I think will talk more about this, how many doctors around the world, they still don't understand, should we really talk about biodiversity degradation or climate change or any aspect of this sustainability that we call agenda in the sphere of medicine. So there are many reasons why planetary health matters. And this is here has just a funny picture that when we have food nowadays, we definitely don't know if it is even food, right? With the processed food we're having, there's so many problems and related to food and nutrition because of the way we have been developing. There are just so infectious diseases you mentioned, Katie, at the beginning, right? And of course, COVID has a lot to do with the zoonotic diseases and with biodiversity degradation. There is a lot of connections there that I think with COVID-19, they're becoming more and more clear. We know that in many areas, when you have resources scarcity, there's also a problem for displacement and conflict. So in the end, planetary health connects, and it's also about global peace in a sense. So if we go here also, these diseases that, according to the World Health Organization, the NCDs, these non-communicable diseases, cancer, chronic respiratory diseases, diabetes, they're really killing a lot of people, more than 40 million people globally each year, and causing, accounting for the 71% of global deaths. So that's very significant. And again, has to do a lot of our environment. And we will see these connections more clearly. And of course, there's a lot of money that needs to be put there to cope with these new diseases. And not only in developing countries, but also we see how developed countries are struggling with this type of problems. I have here one example is if we want to highlight this area of our food systems, when we have nearly 90% of the world's marine fish stocks are now fully exploited. So if you put yourself in the shoes of a small island state, for example, you go there and you have these massive ships just stealing their food, basically. And maybe in urban areas here, we would say, oh, there's always a supermarket, there's always, a new vitamin complex that you can take. But this is their only source of the nutrition, the nutrition source of food that can keep them healthy. So, for example, another example that here in Berlin, I see a lot of sensitivity. Of course, the disappearance of pollinators. They're posing a real threat to our food supply. And this is something that, and there are studies that are very interesting to see that there's not only about the bees, right? There's a whole, many species that would be very important for us to keep that food supply safe. And now in Germany, there was this estimate of a seasonal decline of 76% and midsummer decline of 82% in flying insects biomass. So basically they're measuring how these insects are disappearing. So there are many things that needs to be changed, right? We need to feed 10 billion people around in 2050 without using more land, because we're already at a very stressed, it's already a stretch, and we need to lower our emissions. So how do we connect these things? And that's why this importance of what we call breaking the silos. We need a more integrated approach to these global problems and to public health in general in this time of the Anthropocene. This example, this field of the experts in the planetary health, they also came up with this planetary health diet. And I don't need to enter too much into its details here, but the point is just saying that as these countries are progressing and the middle class is rising, we see the opposite of what we need as for planetary health, which is here on the left, a lot of real food, right? Real vegetables. But we see the increase of consumption of red meat, which we all know the connections also to the environment because of the use of land, of excessive water, and even antimicrobial resistance because of the excessive use of antibiotics for these animals. So all this is connected. So the earth is getting hotter, and I really like this photo. We see a lot of movement around the youth calling for this, but it was very interesting. This is a blog and that we wrote, Kathleen and I, for ISS, saying, is the coronavirus good for climate change? And we believe this question misses the point. And the main point here is to say, we cannot continue separating these two crises. calling COVID a health crisis, and then the climate crisis, trying to compete for attention there. They are simply so connected that the only way we're gonna emerge from this emergency is connecting these two. So in times of COVID, planetary health, really, in my opinion, it's this narrative that can be transformational and more inclusive. There are many of the problems that we outline here. Scientists are very good to tell us what is wrong, but we need to see how can we find the solutions? And the solutions are a lot in our society, in policy, in governance. So we need social scientists to join us in this movement. And planetary health is also then this vision to multi-solve global challenges in the Anthropocene. I find very interesting, we need to highlight that this narrative recognizes that the key solutions to a healthy life are not necessarily inside a hospital. We need to have dysfunctional democracies. We need leaders, accountability, and partnerships. To even, of course, this is the SDG 17, the Sustainable Development Goals, really highlights how we cannot continue acting each organization or each person in their own SDG here, in their own theme. We need this integration for health, for human health. So just in conclusion here, of course, human health in the Anthropocene is at risk because of this drastic environmental degradation. People are dying today, and it goes way beyond COVID. We need the planetary health lenses in public health and environmental studies. It is about prevention. And we are the first to know, and probably the last generation to be able to take action. And this sense of urgency is something that we're trying to convey, and we need to continue trying to highlight. I would like to close, really, of course, we need to break the silos for planetary health. And now is the time to bridge communities for planetary health. And that's exactly the title of our next global summit in 2021. There is the Planetary Health Annual Meeting. This is going to be hosted by Brazil, but of course, this event had to be now turned into a virtual event. So the good news is everybody can attend. You could get more information in the Planetary Health Alliance. And I'm also, as a Brazilian, I'm very pleased to be organizing this event with multiple partners. And we do hope that you can all attend and join us in this conversation. Happy to continue this conversation together with you. Thank you so much. Over to you, Katie.
Thank you very much, Nicole. And I would invite you to share the links regarding the Planetary Health Summit, etc., in the chat for our viewers and listeners. Yeah, thank you so much for the introduction to the concept of planetary health. In fact, you were the one who personally introduced me to the concept when we met at ISS a few years ago. But I think it is really powerful as a concept, one about really being interdisciplinary. It's not just about sustainability science and climate change. It's also about the medical profession. It's about policy. So it's really about having an integrated view of these very complex and interrelated problems. With that, I'd like to turn the floor over to Dr. Martin Herrmann. He is a medical doctor, and he is the president and founder of KLUG, which is the Deutsche Allianz für Klimawandel und Gesundheit, or in English, the German Alliance for Climate and Health. And I know he'll be saying a few more words about planetary health, and specifically about the role of health professionals and patients as change agents to address the planetary health crisis. So please, Martin, the floor is yours.
Thank you very much for the invitation. And indeed, even today, resilience is a key question for all of us. And it's also a concept that has risen in importance and kind of in the last years. And it is clear when we talk about action and when we talk about human connectivities, this is very related to resilience. Just two examples from today. We are all eagerly looking at what is happening in the States. And the question of how to keep democracy alive and how to kind of rediscover what democracy is about is a key question when we look at the planetary health challenge we are facing. And we're very eager to see what is emerging there. I think we understand that they are in the middle of a democracy crisis in the way kind of how the country is split. They have not yet broken the silos. Kind of the silos are very strong. We see it from this election. Just another news from today that I just received 2 hours ago was that intense healthcare units in Germany are now talking about the need to shift to an emergency mode because they're filling up fast, and they will not be able to continue to operate hospitals in the way we have done before. That's another example where a lot of our colleagues are in the middle of an emergency crisis. And that, I think, is a very important concept in the beginning, to make a distinction between resilience when you are in the middle of a crisis and resilience for the long term, because it has very different kind of aspects, but we need to look at both. So as you have said in your invitation, I will very much look at the point from a health professional perspective and what health professionals, what role we can play in this. So I now will share my screen, and now you should see the screen, and I start with a quote from, let me see, I have to go this here, yeah. With a quote from Johan Rockström at the Planetary Health Academy in July. And he was saying, I really am convinced that for us to transition towards a stable Earth system in the future, we can no longer argue this from an environmental perspective. We have to do this from security, health, from peace, and from better living conditions for all citizens. And you, health professionals, are sitting with the key part of this. So he's pointing to this need of how are we framing the game and challenges and threats we are in. And even kind of the way you frame and the liveness in which you tell the narrative of where we are at is a very critical point to getting to more and a higher resilience. And now what I will do is I will look at the planetary health emergency we are having from a medical perspective. And a medical perspective normally starts with a diagnosis, and the diagnosis, making a good diagnosis, is a key intervention and a key part also to then allowing for resilience to emerge. Because if we have the wrong diagnosis of a situation, we will be off and we will not really looking at the things that matter most. So where are we? And Nicole has pointed to it just before. We're crossing the planetary boundaries, and this has led to a planetary health emergency. So it's not a normal situation, it's an emergency. We see multiple ecosystems that have very highly severe dysfunctions, threatening to develop into a multi-organ, multi-ecosystem failure. So that's a risk we are in. This will lead to cascades of nonlinear pathological developments. We face the risk of irreversibly diminishing the habitability of the planet for humans, animals, and plants, with catastrophic impact on health. So that's in a summary what Nicole was talking about, and how we as medical doctors or health professionals would diagnose the situation. This is the frame, this is kind of the challenge we are in, this is kind of the emergency we are in. Now what is very interesting, when we started Klug 3 years ago, the health sector hadn't really understood that this is a major threat to health in our century. And it is only starting now, but it's actually starting it's changing very fast now. So more and more people and association and the German Medical Association are understanding the severity of the diagnosis. And we potentially can also play a big role in kind of educating ourselves and also our patients and our communities to how we can consider what we're in and also what we can do to change this. Because we also understand that while the situation has been known for a long time and scientists have communicated about it, we haven't yet really moved into actions that is needed. So that's the second point, that we as medical doctors, as health professionals, can share and educate about this diagnosis and what it means, and use the reputation and the huge number of direct conversations we have with patients and public. And again, unless you have a right diagnosis, whatever you do will be wrong. So it's very, very important to be clear enough about where we are at, what is at stake, what are the risks, and what we can do now in the short term and in the long term to move forward. And there's another point: when you have a very difficult and complex diagnosis, it's important to reassure ourselves on what is our ethical ground, what is the ethical imperative from where we act. So is it like a normal situation? Do we even have to revisit what our values are? Kind of how do we move on from here? And there I just want to point to a development of the last weeks, together with a few colleagues from Klug and around the world. We have developed an article in the Lancet where we propose a revisiting of the Hippocratic Oath and the Declaration from Geneva, which is usually the ethical foundation of us as medical doctors. And we suggest a pledge for planetary health to unite health professionals in the Anthropocene. So we are clearly saying when we move on, we should not just have a pledge for medical doctors, we should have one for health professionals and also invite other professions to find their own pledge, which is based on acknowledging the planetary health crisis we are in. So the first sentence of the suggested pledge goes like this: I solemnly pledge to dedicate my life to the service of humanity and to the protection of natural systems on which human health depends. Because once I understand the diagnosis, and once I understand my role as a health professional, it is clear in my lifetime, this challenge will not go away. So I have to make it a priority and a key kind of cornerstone of what my life is about. And this is an invitation to all other health professionals and all other professionals to work from the same ground. That's another way of working from a different ethical ground, which is to go on the streets and make public where we are at. And one very strong way of doing this is to go out in manifestations or in critical locations. This is kind of at the Siemens Hauptversammlung this year in January, and it ended up being in the Tagesschau, the main news show of Germany, and so millions of people were seeing our manifestations here in Munich. That's another way of going out and being consistent with our pledge and with understanding that we are in the middle of a health emergency. And then the next point is, of course, when we understand and have the diagnosis, then there is the question of how do we move on? How do we get to transformative action? Because what we have in front of us is a very complex situation. So we need to better understand and educate ourselves how we can intervene, what we can do. And again, some of the concepts in medicine might help here, because also in medicine, we oftentimes have the requirement of dynamic and flexible interventions, therapies, measures to work in different dimensions from different professional perspectives. And also we have different layers of action. So for example, in what we have in front of us with the planetary health emergency, there are very obvious, simple measures. Once you understand, it is very obvious what you can do with many things. There are also complex measures which take more long term. A lot of the things we can handle with an emergency mode, but at the same time, we need to be strategic and look at the long term. A lot of the things we can do locally, but also we need to network regionally on a global scale, and we need to be able to work on both sides. A lot we can do from bottom up, but we also need to work with the people who are at the head of hierarchies and see how this can influence each other. As Nicole has mentioned, it is very much to break the silos. So it is within sectors, some things, but also across sector, within disciplines and across disciplines. Some of the things have to be changed in legal requirements from the state or the roles that the state plays. Others have to be done on the market. Of course, we need a master plan. At the same time, we need the ability to improvise. For example, in a situation like now, when a crisis emerges very fast, in the beginning, you won't have a master plan and still you need to be acting. And then there's also a lot of things where we need technical interventions, but in other areas, we also need to have power interventions. Because some of the cases are so clear, but they are just vested interests of strong power groups like the fossil fuel industries or others who don't want to go into the changes because it would mean that we take them out of business, and it's one of the things we have to do. So what I'm proposing and are seeing is that health professionals and patients can be very powerful change agents, and one of the key things that we can do is reframe the planetary health emergency as a health crisis and go away from only framing it as an environmental crisis, and that we kind of get together in networks, be very creative with each other and work on transformational change in very different facets and settings. Just two small examples. Yesterday we had the first planetary health lecture in Eastern Africa, and there's a small group now of Eastern African health professionals starting to build up an Eastern African planetary health hub. This is an example of how we can cooperate across the planet. And then I have another example. Last year, and now in June, May, we started with the Planetary Health Academy to educate how we get from knowledge to transformative actions. And we were overrun by interest. We had between 1,000 and 1,500 people joining us, and we are now offering a next series. So from there, I leave it like this, and I'm very happy to look forward to our discussion later. Thank you.
Thank you very much, Martin, for providing this perspective from a health professional or for health professionals in general, and also with this lens of doctors speaking about a diagnosis. I think emphasizing the fact that we need to get the diagnosis right in order to get the treatment or course of action right is of course really important, and really goes back to some of Nicole's points about looking at the complexity of the problem. It's not, the problem with COVID is not a narrow, okay, the problem is that we don't have a vaccine yet. And the problem is also not just, okay, climate change, but we need to be looking much more broadly at these complex interconnections. But of course, that raises challenges as well. With that, I'd like to introduce our next speaker. Dr. Martina Schaefer holds PhDs in environmental technology and sociology, and she's a professor at the Technical University of Berlin, where she directs the Center for Technology and Society, which is ZTG, Zentrum Technik und Gesellschaft. And she's going to speak to us for the next few minutes on the topic of dealing with disruptions of the normal and lessons learned for sustainability transformations. So with that, I give you the floor, Martina. Thank you.
Always the same mistake. Okay, thank you very much. And I'm very glad to see that we're still a lot of participants here. And thank you for inviting me. I will do a shift to normal life, to daily routines, and the lessons learned maybe we can draw from COVID-19 crisis. So first of all, COVID-19, as we all experience right now again, has interrupted unquestioned daily routines and opened a window of opportunity for reflection on the one side, and also experimentation with new practices. So reflection, for example, about everything in supermarkets available at any time, or the freedom, at least for a small percentage of the population in the global north, to travel globally, and the risks linked to it. So these are issues of reflection we dealt with during the last months, but also some experiments. Maybe everybody from us experimented with some new practices, like using the bike more often, having holidays in the region, or at least on the national scale, turning more to do-it-yourself activities because we had to work less, or at least some of us. Turning to digital social events, meeting for Easter holidays with our relatives via the computer. So these were experiments, and we all know that for transitions also to sustainability, these experiments with daily practices are very important. And then, of course, going on, the stabilization of these experiments is important. But first is this, the interruption of these daily routines and having a motivation to experiment. Second point, like a burning glass, the crisis has also contributed to realize what is important. First, of course, health, very important issue, but in normal times, it's not as prominent as it was in the last weeks. But also very prominently, social relations. I think this has really struck us, all of us, during the last weeks, what it means to be interrupted from our daily social relations, and how important this is and how much it affects our lives. But also solidarity between generations. We all know that here we had to be careful with the more vulnerable elder persons, but in general, solidarity with the more vulnerable and also socially isolated persons. So very important values that, yeah, we got really reminded very deeply in these last weeks. Then what was also very prominent, I think, that we saw that depending on available social networks, but also individual resources and competences of dealing with situations of change, different segments of the populations have different capabilities to cope with these new challenges. So we saw that, of course, segments of the populations with big apartments, with houses, which facilitate arranging oneself in the home office, with good technical equipment, with access to garden, balconies, parks nearby. So all these issues also of environmental justice came into, were very important in these weeks. And we saw that some of us were privileged and others not. Also, of course, advantages for people who can deal with their work more flexible, while others who had to continue to go to work, and they were called sometimes the system relevant groups, they depended a lot on good provision with childcare, with public transport, which is not always given. And I think this also pointed out the importance of these services. I think this crisis, and it would be very similar probably if we deal with the climate crisis, has demonstrated that there's a high risk of increase in social inequality if appropriate governance measures are not taken. And fortunately, this time, some important measures were taken to at least equilibrate a little these social inequalities. But we still see that the more vulnerable are hit more severely. And this is, I think, also very important lesson learned we can take with us. We also learned something about the fragility of complex systems of provision, as for example, global food chains. We saw that the cheap provision with a high variety of food all year round depends a lot on externalization, on cheap working forces in other countries, or seasonal workers, which suddenly couldn't enter the country. Depends a lot on transport all over the globe. So there's a vulnerability of these complex systems and a certain shift maybe towards regional value chains. But we also saw that other systems of provisions, so the public access to high quality health provision, of course, became very transparent in these months. And we saw it in comparison of different countries who had saved a lot of resources in that field, that they had real difficulties. So health provision with sufficient personal resources, but also well-equipped schools who can react to crises, etc. So these resilient systems of provision, I think this became very clear in this moment of crisis. On the other hand, the importance of attractive neighborhoods, of accessible public space and culture, cultural services, cultural offers, that became also very clear, the importance of this for a society, for an attractive social life and society. COVID-19 also has illustrated to which extent societies are able to deal with severe crisis in a joint effort, and that adaptive management is necessary in situations of high insecurity. And this we have been talking about a lot in sustainability transitions in the last years. Yeah, adaptive management, possibilities or abilities, competence to react in situations of insecurity. And this was a really showcase for this kind of management. So we saw that it is possible to take decisive action on the side of the government if it is combined with good communication, aiming for a high degree of transparency. And surely Germany, but also many other countries have done some errors in this field, but I think they tried. And of course, without neglecting democratic principles. We have also seen the high importance of a very good quality science policy interface. So we saw that it is still very important to get this current data, to have a good context to science, who can react quickly on urgent questions and communicate and do interpretation on the data to inform policy making. And I think it was as open as never before, that there was really an open communication of a responsible try and error mode. And we are still in this, yeah? So nobody knew and nobody knows up to now what is really the right way of reacting. But this was really also communicated. Look, people, we have to react now. We cannot wait till we are really sure about the right way. But we'll see, and we'll always observe it. And then if it doesn't work out, we have to adapt our measures. And that's what we have been doing during the last weeks. And that was something, or is something that was never tried out in the sustainability in the climate issues. There we often heard, yeah, we don't know exactly yet, and we have to wait for more data, and we have to wait for more scientific evidence. So we see it is possible to react like this in crisis. And I think we can learn from that. And I think also we can take away the good news that we saw that national governments are able to act or to react. And the majority of the population accepts this reflexive governance style. If, on the other side, transparency is granted to a certain degree, at least. So we saw there is some criticism, but it's still a minority. And if measures are explained well, they are accepted by a majority. And
Martina, would you mind unmuting yourself?
Yeah, I don't know why it happened. It's somebody is here doing something. Well, I'm coming to the end, if this was a sign. So we often heard that we cannot act on a national level. We have to wait for the EU. We have to wait for other international contexts. And of course, this is a debate right now too, but national states reacted. So we saw it is possible. And that it is important also to prevent worse consequences. So I think this is quite a bundle of lessons learned we can take with us to a certain extent, or at least I want to propose to discuss about it. I have to say this is not, this is based on some explorative, empirical investigations. We did some interviews on changes of daily practices, and we're still, it's still work in progress. But I thought, nevertheless, this is a good occasion to share these hypotheses more, or these observations. And yeah, I'm eager to see your reactions on it. Thank you.